Hi everyone, my name is Leslie Bracamontes and I will show you this project titled Food Habits and Nutritional Status of Mexican Children with Acute Lymphoblastic Leukemia. This project has been directed by Dr. Veronica Lopesteros and co-directed by Dr. Katia Stein from the Guadalajara New Hospital. Which we want to say a special thank you for letting us use their databases for this project. Acute lymphoblastic leukemia, as we know, is the most common cancer among children and adolescents. Dietary habits can have an influence on patients' nutritional status during and after treatment. It has also been shown that patients who are survivors of acute lymphoblastic leukemia can also develop another type of chronic disease, compromising their adult life. So multiple factors are associated with the illness and treatment, and these factors can affect nutritional intake in ALL patients. So the opportune nutritional approach on ALL patients can preserve body composition and also nutritional status. But there's limited information about dietary intake among these patients at the beginning of the treatment in Mexico. So that's why we aim to analyze the correlation between dietary habits and nutritional status at the time of diagnosis among Mexican children with ALL. As methods for this project, we first selected the subjects from databases of the hospital. We collected a total of 142 patients of these databases with recent ALL diagnosis and ages 2 to 18. And we divide this database as follows: from groups 2A to F and these ages. And this is the reason to this is because we wanted to compare them to Mexican dietary guidelines. So we needed to also divide this database as same as the dietary guidelines. Then we did the analysis. We analyzed food frequency questionnaires, the ones that we got on the databases for patients in the first time of diagnosis, in the first month of diagnosis. We analyzed portion recommendation versus portion that was reported. We also analyzed nutritional status determined by Antro and Antro Plus software, and we got the BMI-H C-score. So for the statistical analysis, we compare the food frequency questionnaires with the Mexican dietary guidelines using a Wilcoxon test. It is important to mention that we use the recommended portion for as reference value for the Wilcoxon test. So for the when we wanted to know how the intake was affecting or influencing the C-score BMI-H, we made a correlation matrix adjusted by age and sex. It was a Spearman test, and we use these values for statistical significance. For results, we observed that 17.1% of the patients had overweight at the beginning of treatment, which has been shown as a risk factor for ALL patients because it can increase the secondary effects that I mentioned above in the introduction, for example, risk of infections, etc. We saw that vegetable intake show a negative correlation with the BMI-H C-score, which means that less consumption of vegetables would be higher the